Contraceptives are medicines and other devices that use to prevent unwanted pregnancy. The following are the methods of contraception. Natural method of contraception includes natural family planning methods which do not include any chemical or foreign body introduction into the human body. Most people who are very conscious of their religious beliefs are more inclined to use a natural way of birth control. Some want to use natural methods because it is more cost-effective. Abstinence. This is the natural method involves abstaining from sexual intercourse and is the most effective natural birth control method with ideally 0% fail rate. It is also the most effective way to avoid STDs. However, most people find it difficult to comply with abstinence, so only a few of them use this method. Second, the Haledar method. It is also called as the Ritim method. This natural method of family planning involves refraining from coitus during the days that the woman is fertile. According to the menstrual cycle, 3 or 4 days before and 3 or 4 days after ovulation, the woman is likely to conceive. The process in calculating for the women's safe days are achieved when women records her menstrual cycle for 6 months. An ovulation detection method is an over-the-counter kit that can predict ovulation through the surge of luteinizing hormone that happens 12 to 24 hours before ovulation. The kit requires the urine specimen of the human to detect the luteinizing hormone. Coitus interruptus. This is one of the oldest methods of contraception. The couple still proceeds with the coitus, but the man withdraws the moment he emits semen and emit it outside the female reproductive organ. The disadvantage of this method is the pre-emission fluid that contains a few spermatozoa that may cause fertilization. Artificial method includes contraceptives, transdermal patch, vaginal ring, subdermal implants, hormonal injections, intrauterine device, chemical barriers, diaphragm, cervical cup, male and female condoms, tubal ligation or sterilization, and vasectomy. Contraceptives, also known as the pill or oral contraceptives, contain synthetic estrogen and progesterone. Estrogen suppresses the follicle-stimulating hormone and luteinizing hormone to suppress ovulation, while progesterone decreases the permeability of the cervical mucus to limit the sperm's access to the ova. Transdermal patch. Transdermal patch has a combination of both estrogen and progesterone in a form of a patch. For 3 weeks, the woman should apply one patch every week in the following areas: upper outer arm, upper torso, abdomen, and the buttocks. And at the 4th week, no patch is applied. The menstrual flow would then occur. The area where the patch is applied should be clean, dry, free from any applications, and without any redness or irritation. Vaginal ring. The vaginal ring releases a combination of estrogen and progesterone and surrounds the cervix. This silicone ring is inserted vaginally and remains there for 3 weeks. Then removed on the 4th week as menstrual flow would occur. The woman becomes fertile as soon as the ring is removed. Subdermal implants. The subdermal implants are 2 rod-like implants embedded under the skin of the woman during their menses or on the 7th day of her menstruation to make sure that she is not pregnant. It is effective for 3 to 5 years. A hormonal injection consists of medroxyprogesterone and given 12 weeks intramuscularly. The injection inhibits ovulation and causes changes in the endometrium and the cervical mucus. The intrauterine device. An IUD is a small T-shaped object that is inserted into the uterus via female reproductive organ. It prevents fertilization by creating a local sterile inflammatory condition to prevent implantation. The IUD is fitted only by the physician and inserted after woman's menstrual flow to be sure that she is not pregnant. The device contains progesterone and is effective for 5 to 7 years. Diaphragm. It works by inhibiting the entrance of the sperm into the female reproductive organ. It is a rubber disc that fits the cervix and should be placed before coitus. The diaphragm should be fitted only by the physician and should be remain in place for 6 hours after coitus. Cervical cup. The cervical cup is another barrier method that is made of soft rubber and fitted in the rim of the cervix. Its shape is like a thimble with a thin rim and could stay in place for not more than 48 hours. Male and female condoms. Male condoms is a latex or synthetic rubber sheet that is placed under the erect male reproductive organ before penetration in the female reproductive organ to trap the sperm during emission of semen. It can prevent STIs or sexually transmitted infections and can be bought over the counter. There are also latex rubber sheets that are made specifically for women. It has an inner ring that covers the cervix and an outer open ring that is placed against the opening female reproductive organ. These are disposable and require no prescription. The tubal ligation or sterilization. It is a surgery for women in which fallopian tubes are tied to prevent eggs from traveling to the uterus so as women cannot get pregnant. And lastly, vasectomy. It is an operation in which a surgeon makes a small cut in the upper part of the scrotum, then ties or blocks the vas deferens.